So welcome to this short tutorial on how to do a manual blood pressure. For this tutorial we're going to assume that you've gained the patient's consent and that you have adhered to your organisational guidelines on PPE and stuff like that as related to patient contact. So the few things you're going to need when you do a blood pressure are a sphygmomanometer, and there's a variety of different ones you can get. This is one by, looks like that. Then we've got one that's got a red cuff and got a grey cuff. These are all the same size cuffs. You will probably also find differences in where the dial is on this one and the bulb on this one. But in some of them they're incorporated, as in this one and this one. And the other key difference is this one here has a push button and this one has a rotating dial there that you can see that. But essentially what you will notice is they all have exactly the same numbers on the screen, on the dial there. So that really doesn't matter. It's just giving you an idea of the different cuffs, the blood pressure cuffs that you might come across. The other thing with the blood pressure cuff that you're going to have on all of them is the cuff itself. And the cuff itself is usually Velcro, and it comes in a range of different sizes. And what you're looking for is this index and the range. And if the blood pressure, when you're putting it on the arm, fits within that range, it's going to be the correct size for that patient. And we've already determined that this is the correct size for the patient today. The other thing you will notice is an indicator. Here it says for left arm and right arm, and an arrow pointing to the brachial pulse. Now some of them will just have artery on there and you just adjust that, but this is the one we've got here, and we're using it on the left arm today, so we'll be looking for that indicator there. So that's your sphygmomanometer. The next thing you're going to need is a stethoscope, and again you might get different varieties of these, but obviously these are your earpieces, and this is what's called the diaphragm, this part here. This is where we're listening to it. If you can't hear it through this, it might be because this piece here has been rotated away. If you listen through the stethoscope and gently rub on here and rotate this until you can hear the sound, then you'll have it set to the correct way that you would need for the blood pressure. The next thing you're going to need is your patient's arm. And on your patient's arm, we're going to note a number of key things that you need to perform a correct manual blood pressure. The first one is identification of where the stethoscope is going to be placed on the arm. Now you've probably seen people place it anywhere around here, and it's incorrect. We need to be locating where the brachial artery is. You'll look at the hand with the palm facing upwards. The brachial artery sits on the inside of the arm down here, and it's quite deep but sits just sort of above the about elbow. And once I've palpated where that is, that's where I'm going to place the diaphragm of the stethoscope when I take the blood pressure. The other key thing I need to note is where the radial pulse is, and this sits down from the thumb into the wrist. And if you look at the other tutorial, you'll see about how to take a pulse. Now when you're taking the blood pressure, we need to make sure that we know where this is and where this brachial pulse is. Once we've determined where they are, we're going to apply the blood pressure cuff to the patient, remembering that this one has left artery on it, left arm, and we're going to lay that over where we found the brachial pulse. Just going to ask the patient to lift their arm up a little bit as I bring the blood pressure cuff under. And you will notice just down here, you probably can't see it, that we sit within the range of the correct blood pressure cuff size. This one's really handy because I'm going to clip that to the blood pressure cuff, the blood pressure cuff, so we can see it. We ask the patient just to slide their arm down a little bit, and we can hopefully see that there. I'm going to leave that on there when we actually come to take the blood pressure. So what I'm going to do now is I'm going to find where that radial pulse was again. What I'm going to do is I'm going to hold that pulse, and I'm going to increase the needle on this dial using the bulb. And what I'm listening for, or feeling for, is when the radial pulse actually disappears. You'll notice the blood pressure cuff going up. And I noticed the pulse disappeared about 120 millimeters of mercury. So once that's happened, I'm going to decrease the blood pressure cuff. And what that's told me, that figure there, is where I expect the highest reading of the blood pressure to be. So, and I say expect because I haven't listened to it. I'm listening for two key numbers when I'm recording a blood pressure. So what I'm going to do, just to make absolutely sure that I've got my number correct, I'm going to pump this up to just about 10 to 20 millimoles of mercury above where I last heard that blood pressure. And so for me, that's going to be around about 140 millimoles of mercury. I'll lay the blood pressure cuff on there, blood pressure dial on there so you can see it. And then I'll put my stethoscope over where the brachial artery was. And we found it about there, didn't we? And then what I'm going to do is, this where you probably need 3 pairs of hands at times, but I'm going to gently increase the blood pressure using the blood pressure cuff, using the bulb, observing the needle on here to get to the 140 that I wanted it to go to. And when I get there, I don't need to go any higher than that, but on the side you'll notice the little dial there. I'm going to gently release that and the needle will move down. I'll be listening for the sound, the first sound that I hear, and you'll see on the dial it dropping down. And the sound increases and then decreases until it eventually stops, which is about now. Once I've got that top number and the bottom number, I can just release the blood pressure cuff because the blood pressure has now been recorded. So we first heard a sound about 120 millimoles of mercury, about here. And then when it decreased, I lost the sound, I didn't hear any sound, about 70. And what I was hearing was the pulse there, the pulse going through. So I heard it at 120 and it dropped off at about 70. So that means our patient has a blood pressure of 120 over 70. And 120 is what's recorded as the systolic and 70 is the diastolic. And so these are recorded in the appropriate documentation for your organisation as a blood pressure of 120 over 70. I'll then remove the blood pressure cuff. I'll thank my patient for their allowing me to record the blood pressure, and then I'll wash my hands as per organisational protocol. Thank you.